On this webpage, the International Chair on Cardiometabolic Risk provides a step-by-step video on how to self-measure your waist circumference. Many studies have shown that measuring waist circumference is the best and simplest way to estimate how much abdominal fat you have. However, you have to know how to interpret the measurement results in order to determine whether they indicate high-risk abdominal obesity. Based on the relationship with body mass index, the BMI, threshold values of overweight, defined by 25 kg per meter square, or obesity defined by 30 kg per meter square, organizations such as the National Cholesterol Education Program Adult Treatment Panel 3, so-called NCEP-ATP3 guidelines, have proposed waist circumference values of 102 cm for men and 88 cm for women. These values correspond to a BMI of 30 kg per meter square, defining obesity. However, interpretation of BMI is limited as it cannot be used to establish valid waist cutoffs to predict potential additional risk. Furthermore, age and ethnicity affect the relationship of waist circumference to visceral fat and related health risk. For instance, we know that Asians are more prone to diabetes for a given waistline. This phenomenon may be partly due to the fact that Asians are more likely to store visceral fat than Caucasians at lower BMI values. In addition, African Americans are more likely to store fat subcutaneously than Caucasians. A single cutoff of 102 cm in men and 88 cm in women may therefore be unsuitable to define excess abdominal fat in all populations worldwide. An International Diabetes Federation committee on the metabolic syndrome attempted to address this problem in its 2005 guidelines. Table 1 summarized the International Diabetes Federation waist circumference values according to ethnicity and sex. However, these values have not been validated against hard clinical outcomes and therefore provide ballpark figures to patients and their treating physicians. This table has been endorsed by the Canadian Guidelines on Obesity, which have also emphasized that waist measurement is a vital sign that needs to be assessed in clinical practice. However, as previously mentioned, men and women, as well as various populations, differ in their predisposition to store abdominal fat and in its relationship with diseases. Waist circumference value used to define abdominal obesity should therefore be sex and population specific.